Auzubillahiminashaitanirajim. Bismillahirrahmanirrahim. Assalamu alaikum and a very warm welcome to World This Morning. I'm your host Hajra Satti and joining me is my wonderful co-host Fahim Bangesh. Assalamu alaikum Fahim. Ramzan al-Mubarak. This is our first Ashura going on and second Roza.
Absolutely, and Ramzan Mubarak to you too as well. And I think it's should be a happy Ramzan.
Yes.
I hope this is a happy Ramzan.
Yes.
Although the year has been tough, although 2022 has given us a lot of tough times, but still, we are still hoping for the best. We are still hoping for better news, good news, wonderful news to come our way, because although we're passing through a difficult time, but then again, what is Ramzan? Ramzan is all about tolerance. Ramzan is all about perseverance. Ramzan is all about moving through any difficult time, any difficult circumstance with thanks to Allah.
Alhamdulillah, thank you so much for brilliantly putting it out. And I think we have been having this conversation on our show about what are the physical benefits of this month of Ramadan. And I particularly like the vibe and the spirit of Ramadan, which is so much visible in the public spaces, especially at the time of the iftari, when you can see there's so wafting aroma, which is really wavering through the streets because there's a lot of eatables or pakwans that are made. But having said so, obviously, apart from the physical benefits of the Ramadan, it has a certain spiritual component of it.
Absolutely,
and
yes.
like Fahim wonderfully put it out, how the patience, perseverance and the tolerance are the main virtues which are imbibed in us because of the Ramadan, because of the fasting. And Allah subhanahu wa ta'ala verily mentions in the Quran that the rosé or the fasting was made compulsory on us like the people before us, so that we can become more pious, right?
Absolutely,
and
like we were discussing in one of our previous shows as well, that piousness is something, taqwa is something that we must look forward to in the month of Ramzan, because that's what we're practicing in the holy month of Ramzan, so that we can carry it forward in the rest of the 11 months as well. And like you were mentioning, Hajra, the wafting aromas, we must never forget the poor people around us in our society, in our communities, who are there at the time of iftar or suhoor. If you're awake, if you're there, if you can afford the fuel, you should go around and move around and see who are the deserving people who would be looking forward to perhaps your help. And I think a research is needed in these difficult times, that we must look forward to any people who cannot beg perhaps, and yes, they must be helped.
Exactly, and thank you so much for saying that. And obviously I want to contemplate a bit upon the concept of the piety, taqwa, God consciousness, God fearing, and I think this concept is as broad as our universe, and it has such a multi-dimensional aspect of it. And obviously in the days to come, we will contemplate on the concept of the taqwa, of the piety, what does it encapsulate. Having said so, Fahim, today is 24th of March, and it's one of the very important day, because today world is observing the World TB Day, Tuberculosis Day. And we also know that our founding father, Quaid-e-Azam Muhammad Ali Jinnah, he passed away because of this disease, but at that time it was incurable. But because of the progress in the science, in the medicine, obviously this disease is curable. So I would like to take this opportunity to share some of the facts about the TB. So the theme of the day is yes, we can end TB, and according to WHO, 74 million lives were saved since 2000. 10.6 million people fell ill with the TB in 2021, and 1.6 million people died in 2021. Obviously, if we do not attend to this particular disease, it can be fatal, it can become a deadly. But I think we have a more pictorial representation, we have a video, we have a package prepared for that, because it's more engaging and we want to contemplate on the facts and figures regarding the TB. So don't go anywhere, watch this package.
National Health Services, in collaboration with World Health Organization, organized a seminar to raise awareness on TB situation in Pakistan. The seminar, under the title of We Can End TB, was held at Pakistan Institute of Medical Sciences and attended by senior leadership of Health Ministry and WHO. Speakers, while addressing to the event, said about 500,000 new TB cases are emerging every year in Pakistan. They said, despite challenges, Pakistan is working to reduce TB burden in the country.
We are fifth TB-wise, and with regard to multi-drug resistant TB, we are fourth in number. That's among top 30 countries. That's our number where we are placed right now. So it's an alarming situation, and the government of Pakistan is making all efforts and taking measures to eradicate TB from Pakistan.
WHO head Dr. Palitha Maipala said Pakistan has done good work in eliminating the disease.
I am so happy to see that Pakistan is moving on the right track according to the recommendations made by World Health Organization to end TB in Pakistan.
Officials said Health Ministry will improve the TB situation in the country in upcoming months.
And we will enhance the scope of testing and screening of the TB so that we can come to know that whether the TB positive cases are being properly treated or not.
They said key reasons for emergence of TB include delays in diagnosis and poor follow-up for the treatment. Health officials in the seminar said government is providing free of cost treatment of TB in the country, and collective efforts of nation can eliminate this disease. Rahul Bisharat, PTV World, Islamabad.
Well, that's a wonderful report prepared by our team on the World Tuberculosis Day. That's on the 24th of March. Yes. And with that, I would like to introduce our guests with us. And in the first segment, we have Dr. Karam Shah with us, who's a public health specialist. Dr. Karam Shah, welcome to PTV World this morning, and a very good morning.
Thank you very much. Good morning to you.
Right. So, joining Dr. Karam Shah, we have Ms. Kinzul Iman. She happens to be the community rights and gender advocate. Assalamu alaikum, and thank you so much for coming to our show.
Walaikum assalam. Thank you so much for having us.
Okay, so today is World TB Day. Obviously, you are experts in this field. So, Dr. Karam Shah, let's contemplate a little bit about what exactly is this disease, what are its symptoms when we talk about TB.
Thank you very much for having me today, and very good morning again.
Thank you.
Yes, indeed, TB, as we watched this brief television recording of our program managers and the policy makers, we are basically fifth among the high TB burden countries in the world.
Right.
Regarding the symptoms, the common symptom of TB is cough more than 2 weeks.
Mm-hmm.
And if along with cough there is a fever, night sweating and sputum, and sometimes there is a blood in sputum. So these are few symptoms whereby someone should start considering that he or she might be having tuberculosis.
Okay.
So that is basically the first entry point into the health services. That must be.
Also, Dr. Saab, if we talk about the different types where tuberculosis can basically harm the body, be it the meninges, be it the intestines, be it the bones, could you shed some light on that too?
Yeah, mainly because it is a droplet infection.
Right.
It is a contagious, it basically someone inhales TB bacilli through air when a patient is basically nearby.
Mm-hmm.
So it means that the entry point of these bacilli is in the lungs. So mainly majority of cases are pulmonary tuberculosis.
Right.
So lungs are majority, I mean in the main majority
they're
of
involved.
the cases they are involved. But then the bacillus also travels from lungs to other parts of the body. So one can have TB in lymph glands, in abdomen, in bones, even in the skin, even in eye, but those are rare. But the majority of cases are the lung diseases, and they are contagious also.
Right.
So we are the priority for the program and for us is to take care of those patients so that the transmission line is cut as soon as possible.
I see. So also, Doctor, I would like to ask, as far as the vaccines are concerned, we do administer the BCG vaccine to our children as soon as they're born, especially in this part of the world, Pakistan, India, basically the subcontinent. But we don't see that happening in the West. Any particular reason for that?
You know, the reason is basically we are high prevalent country.
Okay.
We are fifth among but the globally we are fifth.
Right.
So BCG has been basically the part in the package of EPI vaccination, right from 1960s. So this is therefore there is a need of continuing BCG, although there is a debate on the efficacy and efficiency of the BCG, but it is at least in country like Pakistan, it is mandatory to have BCG at birth and then at the point of when the boy or girl enter into the schools. So that gives immunity to certain extent, but not 100%.
Okay. Okay, so moving on, Ms. Kinsuleman, since you are community rights and gender advocate, and I think we were having this conversation before the red light went on in the camera, and she told us that women are disproportionately affected by the TB or the tuberculosis. Why do you believe that women are disproportionately affected? Would you like to contemplate on this assertion?
So one thing is that the factors of the disease or the biological factors. The other thing is the access to care, or during the care and support if a person is diagnosed with TB, the stigma that is associated with the disease. When it comes to excess, the excess of women is dependent on men, and the priority that has been given to women, even in the economical perspectives, is disproportionate in Pakistan. That accordingly multiplies the effect, and that too accompanied with one of the symptoms of tuberculosis is blood-stained sputum. The perception in the rural area, once a woman starts having blood-stained sputum, is that maybe she's jinxed or something.
Right.
And that actually leads to the women being thrown out of the household rather than taken to care.
Right.
So the message that we can actually give to the community through the use of media is also this, that if a person is coughing more than 2 weeks, having fever, or gets abnormal, there is an abnormal weight loss, night sweats or blood-stained sputum, they should be taken to the nearest TB care facility rather than sort of delaying it for a longer time.
Right. So let's, I think, contemplate on the spatiality aspect of that, or the spaces where women are occupying. For example, rural versus urban divide, which you alluded to in your conversation. So obviously women who are living in the rural areas, according to you, they are more, I mean, because they are more shrouded in the very emotionalism sort of a belief that they might be jinxed, or maybe the literacy rate is not that high as compared to the urban areas, right? And obviously a lot of people misquote Islam and believe that, you know, maybe Allah ki marzi hai, or maybe Allah has defined a lifespan, right? And they do not go and access the medical health care based on this belief. And obviously this is a very wrong perception. This is a misconception surrounding the Islam or their religious beliefs in the first place. So, and let's bring your activism in this gap. How are you bridging it, and what sort of work are you doing regarding the awareness on the TB?
So in the recent past, a community rights and gender assessment was done in Pakistan across the provinces. All the provincial TB control programs and the national TB control program was part of this. And there were certain key areas identified. One of them was access to care, the availability of care, the acceptability of care, even if the care is there. For example, if a male doctor is treating, women might not go to them.
True.
On the contrary, it came from the male patients as well, that if there is a female doctor, we are not comfortable in going to her. So even if with the services being there, the acceptability issue is there. And then there is a quality stance. Like for example, people want to go to private sector. There is a perception 80% of the people rather go as a first point of care to the private sector. On the contrary, the engagement of the private sector at the moment is not that much. So private sector engagement expansion was also identified as a key area. And then there are certain key vulnerable populations. These key vulnerable populations can be because of the biological factors, including if a person has silicosis, if a person is affected by cancer, their immunity is already low. So they are more susceptible to getting the disease. Then there are factors if people are living in overcrowded regions, because the disease is contagious, it can spread through cough from one person to another. If people are living in crowded settings where the flow of air is not that much, so we need to work together to come up with interventions where these key vulnerable populations can be provided access to care and remove these barriers that exist in our society in enabling people to get to the care.
And like you were talking about vulnerable populations, Dr. Saab, when we say vulnerable population, we think about women, we think about people with comorbidities. Now, when we talk about pregnant women, do you think that tuberculosis will be transferred to the child which will be born? And secondly, after the child is born, will the mother be able to breastfeed the child?
Yeah, I think this is a very important question, because there are less chances of transmission of TB when the child is basically before child is born.
Right.
But after that, it's again not because of milk, but because of the contact of mother when there's she's feeding the child. There is a chance that, I mean, if the mother has TB positive, then there's a chance that bacillus would be I mean, the child would contract TB. So, and then if child has TB, it's a bit serious. The reason is because of the immunity. The TB spreads very fast, and it's basically in a severe type of the TB to the child. So,
because the child has yet to develop its
yes,
immunity.
but it doesn't mean basically that we should avoid breastfeeding.
Okay.
That's very important.
Okay.
Because the best part of that is that if someone is treated with TB, within a couple of weeks, the patient becomes non-contagious.
Okay.
So the better way is to treat mother, so that basically she's not she's no more contagious.
Right.
So continue breastfeeding. That's basically a very clear message.
And also, Dr. Saab, as we're talking about tuberculosis, we must speak about the treatment and the screening, because obviously
Exactly.
a person who has been diagnosed with tuberculosis, does the whole family need to be screened? And if we're talking about screening, what are the methods for screening?
Luckily, in Pakistan, we have access to the diagnosis in every BMU. BMU is basically basic management unit, like rural health center, district health hospital, even in some of the basic health units, we have the facilities of diagnosis, and it's very easy. Prior to Gene Expert basically is a machine nowadays, which is available everywhere in Pakistan. So prior to that, there was a sputum test by the microscopy. So now Gene Expert makes life very easy. So screening is easy. Someone is sputum positive, and the treatment is very easy. It's a 6 months treatment, oral treatment. There's no more injections. There was streptomycin, if you remember.
It used to be very difficult. Yes.
So now it is basically all about pills for 6 months.
Yes.
And it is 100% curable.
Okay.
It's 100% curable.
Okay.
So regarding the context, I think this is a very important to understand that in TB we say that treatment is better than prevention.
Okay.
Because you treat people,
Oh.
you cut the transmission line.
Okay.
So therefore, it is very important that if someone is sputum positive, and program has basically this in one of the mandates, and they are encouraging National TB Control Program and Provincial TB Control Program, and of course through media, we are giving this message that anyone who has TB should be encouraged to give access to his family, so that the family is they are screened for active TB, and before it becomes serious, the contacts are basically traced, and if they are positive, they will be treated as TB patients, and if they are negative, then they will be put on preventive treatment.
I see.
Okay, wonderful. So I think building on this conversation, and you said something regarding the symptoms, that how coughing is one of the very pertinent symptom of the tuberculosis, and obviously whenever post-COVID, whenever we cough, it is thought to be it might be COVID, right? So I think the conversation regarding the tuberculosis might be skewed in the favor of the COVID. So do you think this conversation might hinder the actual real conversation surrounding the tuberculosis, because obviously people might think that it can be COVID in the first place?
Perfectly are right.
Right.
The reason is that COVID has same symptoms. It's a cough. It starts with cough, and same is for TB.
Yes.
So what happened in 2019-20 when there was a COVID? Anyone, even a genuine case of TB, was going to a health facility. The care provider's mind basically, definitely it was towards COVID. So in that time, TB was a bit overshadowed.
Yes.
Therefore, because of the stigma, stigma tied up both to TB as well as to COVID.
Okay.
So therefore, in 2019 and 20, case notification not only to Pakistan, across the world, case notification went significantly down.
Okay.
So which was basically, it means that genuine patients were not being diagnosed, so they were spreading the disease in the community.
Right.
But thanks God, now the situation is very good. I mean, the case notification has gone well. You are very right. I mean, COVID has
might have hampered the
overshadowed
effort.
TB.
Yes.
That's true. And now, talking about the social aspects of the disease, Ms. Kinzaliman, we know the compliance is very low in people whenever they're diagnosed with any disease, and especially a disease like tuberculosis, which has a longer treatment. A, they will not comply, and B, especially the family members who are, like Dr. Saab said, they are to be screened, even they are to be put on medications. They will never go under medications that, okay, we are fine. We don't need medications. So let alone compliance of the family members, the main patient even does not comply, because according to my interactions with some doctors, they say the symptoms usually go away after some use of medications, but the compliance has to be there for a period of time. So why is there, and how are we supposed to increase that sort of awareness in the masses and communities, especially in the rural centers of Pakistan? Not just Pakistan, of course, this is something that's prevalent in this part of the world.
What we always call that TB is not just a health problem, rather it's a social issue. Malnutrition, poverty, living settings, these are social determinants of tuberculosis one way or the other. When it comes to adherence in particular, people, though the medicines are free and the medicines have to be taken continuously for 6 months for a person to be cured, all the contacts of the particular patient who are not active TB, especially the ones under 5 years of age, need to be placed on TB preventive treatment. Now, thanks to God, the recent developments and the efforts from the government of Pakistan, we have TB preventive treatment that has to be taken one month continuously, and the person will be prevented from getting active TB in the household. And we have that preventive treatment available as well, free of cost across the both the urban as well as the rural BAUs of Pakistan.
That's
so
lovely.
that is a great sort of outcome. But again, adherence is very low. That can be conveyed by the healthcare providers. We can use the platform of media to really raise awareness that if a person has been diagnosed with TB, instead of sort of thinking about the primitive thoughts and all, they should be placed on 6 months treatment, and they should continue the treatment till the end, and they can eventually get cured 100. That is sure for 100%. We have developed certain mobile applications to help support patients in adhering to this. One of that is video dots. The person takes the medicine and sends a video. That is for basically drug-resistant tuberculosis, which the treatment for which is from in between 12 to 18 months. So, and there the compliance is even of sort of higher priority as compared to the normal TB. So, a lot of applications have been developed, digital applications, text-based application, like you have to send a note to your care provider once you have taken the medicine. So, these are certain sort of compliance scenarios that are being done to ensure adherence to
Innovative methods to ensure the
adherence.
compliance. You're right.
Wonderful.
Right.
So, I think one last question before we wrap up this segment, and I would really want both of your comments on it, because Dr. Saab mentioned that there is going to be a very high level meeting on the tuberculosis in September, especially at the sidelines of United Nations General Assembly in New York, and obviously such sort of meetings are held when it's a huge health emergency, right? So, Dr. Saab, what is Pakistan's position regarding that conference, and where is Pakistan? What is Pakistan doing in this regard?
Yeah, in fact, the last session of special session on TB in UNHLM was 5 years back.
Okay.
And as you very rightly said, I mean, these are very special circumstances. When things are serious, then United Nations start drawing attention of the countries towards that. So, in that meeting, Pakistan being the signatory of UN, we had some commitments, and we were given some targets of case notification, of multi-drug resistant cases, of the children to be put on preventive treatment. And in this September, we are supposed to go back and report on our agreed commitments and our promises. Yes, because of COVID, we understand that there was few challenges, not only in Pakistan, across the globe. But what we are urging as a civil society organization to government of Pakistan, that time is very short. Now we are less than 6 months. And because of but what we understand that there is a need of highest level representation, at least in that UNHLM. And we are ready, and we offer our services to the government of Pakistan, to National TB Control Program, to prepare them to go back and report on what we agreed last time. So it's a very important 6 months for us.
Okay, Kin Suleiman, you go ahead.
So yeah, high level meeting is just around the corner. We advocate for and we really request the head of state to participate in that meeting. Our disease burden is quite high, but COVID surely hampered our progress. So we really need to kind of advocate for the our country lead, be it the Prime Minister or the President of Pakistan, to participate in that meeting. And one last message using this forum would be, earlier we didn't had any source from which authentic information can be grasped. In collaboration with the Government of Pakistan and the National TB Control Program, we have developed this mobile application called One Impact, hosted by the Pasi Foundation. This app has information related to where access care can be accessed. It has Google coordinates, all the information, what a person needs to do if he has cough more than 2 weeks. You can be linked to a network of TB survivors, people who have been successfully cured by TB, for any kind of information, and you can be connected to psychological as well as social support.
Great.
So in case you have any
amazing.
symptom or anything, you can simply go to your mobile, check both on Android and iOS, One Impact hosted by the Pasi, and it will link you to care. And then there is a helpline, free helpline available nationwide. It's 0800 55 111.
Right.
You can call, you can get all the information you need regarding TB.
Well, yeah.
Yeah, sure, go ahead, Fahim.
It's so wonderful having knowing the fact that so much is being done as far as tuberculosis awareness is being concerned, because mass awareness is needed, because like Dr. Saab also mentioned, we are the 5th country with the highest prevalence of tuberculosis, Hajra.
Yes, that's very concerning, and I think one wonderful thing that emerged out of this conversation is how the concept of support groups is being promoted, right?
Exactly.
And I think it was very prevalent in the West, but in Pakistan we do not find that. But I think here comes the role of social media in bridging that gap, because on Facebook, on Twitter, on a lot of social networking sites,
it tremendously helps people. Yes,
you can bridge that gap, and it really helps a lot of people who are going through it and connecting with the like-minded people or the people who have gone through the same condition. So with that, we will wrap up this segment and say thank you to both of our participants. Thank you so much for coming.
Both of you. Absolute pleasure having both of you. Happy Ramadan to you too. Well, we will be back after a short break. Stay tuned. We have more interesting discussions to come. Don't go anywhere.
Yes.
Welcome back to World This Morning with Hajra Sati and Fahim Bangush. And as we were having a very interesting conversation on tuberculosis earlier, as it's the World Tuberculosis Day today, that's the 24th of March. And as we said, that we will be building on more discussion, but that would be on a different aspect, because this is our second segment. And in the second segment, we have our esteemed guest, Muhammad Abdul Wahab Saab, with us in the studios. Wahab Saab is a public information officer with the United Nations, and also he's a motivational speaker. Wahab Saab, welcome to World This Morning, and a very good morning.
Thank you so much. Walaikum Assalam. It's a pleasure to be here always, you see, and it's always good to see you people smiling.
Thank you, Ji. Likewise, and I think it's always a pleasure having you here. And I think we are so far enjoying our Ramadan, our Roza, because I really love the vibe of Ramadan. But there was one very interesting aspect which Fahim pointed out in our conversation before the Ramadan started, which is we see sort of a dwindling patience in the Ramadan. Obviously, Ramadan or the Roza or the Som, it teaches us, it imbibes us with the values of patience, with the values of sabr, taqwa or piety, which we mentioned, but we don't see a very physical manifestation of that. And I think that is something that we need to point it out, and we need to talk about it, because And especially you can see a lot of impatience when the time of iftar is near, because people are rushing. You can see that the roads are clogged, and you wouldn't see the sort of
the roads are clogged even in normal days.
Yes.
The traffic is mad even in the normal days.
Yes.
But at the time of
Yes.
iftar, these days,
yes.
it's super mad.
Yes.
It's a superlative degree of mad.
Exactly. And then obviously we would want to build on this conversation. So Abdul Wahab Saab, patience, obviously Ramadan teaches us, but why don't we see a very physical manifestation of that, especially on the public spaces, on the roads, and with the tempers of people rising really high, and they are saying that maine roza rakha hua hai. So obviously you are fasting, but that is between you, Allah subhanahu wa ta'ala, and for your own betterment. Exactly. So please, your comments on that.
Right. Ajay, first of all, I would like to appreciate that you have selected a very pertinent topic which relates to the month of Ramadan. You know, when we start talking about implication of this fasting, first of all, we should know what is fasting, what is Islam. Fasting is one of the major pillars of Islam, and what it is meant for. It is meant for piety
Yes.
and nearness to God.
Yes.
How we can gain that piety and nearness to God? Every one of us should understand. In my personal opinion, we need to redefine our society, especially during the month of Ramadan. Just for the sake of fun, a Pakistani guy was speaking to a Japanese lady. He said, you know, from next week we are going to have the month of Ramadan. He asked, why it is special for you? What do you do in the month of Ramadan? He said, he had to take a bit time to recollect what he should say. He said, you know, we are honest in the month, we are regular, we are punctual, we are tolerant, we are truthful, we measure full, we do not indulge in XYZ affairs. She said, you're so lucky you have to do all this only for a month, whereas we have to do the whole set of things throughout the year.
Yes.
You know, so the thing is, Muslims basically, we Pakistanis, we have forgotten basically the basic principles of a society. The basic principles of a society are honesty, truthfulness, loyalty to your own self, to society, to the state,
To Allah.
loyalty to your work as well.
Yeah.
You see?
To your work as well.
At the same time, respect for others.
Yes.
We always want to get respect from others,
Yes.
but we do not want to pay respect to others.
Yes.
You see,
You know, Wahab sir, I'm sorry to cut you up. In this regard,
Yeah.
we were having a conversation at home yesterday, especially and particularly regarding this, that if an Islamic system is prevalent in the society, I don't think that, like you just mentioned, the person had to think what he had to do in that particular 1 month. And what the other people, for example, the Japanese society, they're doing, they've actually adopted it, what we have been asked to do
Right.
in our
Exactly.
daily lives.
Right.
It has been told to us to be adopted as a lifestyle,
Yeah.
whereas we haven't. We wait for that particular 1 month.
You are very correct. I was about to enter that arena. You know, basically what happens, you cannot change yourself for a day or for a month. You are what you are. For 1 month, if you give yourself a feeling, oh, this is the holy month and we are supposed to do all good things, it is possible that 10 to 20% you act on the decades which are going through your mind to your body parts, but your instinct will take back to your character what you exhibit during 11 months. You see, so basically you put on a disguise just for a month, and at times during 24 hours that disguise deceives you and takes back to what you have been doing for 11 months. So basically the thing is, if we really want to be tolerant, if we really want to be truthful, if we want to be honest, we want to be loyal, we want to be very good on roads, we want to be very good in markets, we want to be very good in queues, we want to be respectful towards others, we need to exhibit the same character throughout 11 months. But especially why in month of Ramadan? Because we solemnly pledge to Allah Almighty that you have ordained something which is compulsory on us. You see, we are fasting. Why? I mean, we do not fast for the sake of fun. We do not fast for the sake of physical strength. We do not fast for the sake of dieting.
Yes.
We fast because God has ordered that. With that order, He has given complete set of guidelines. Your fast shouldn't be the fast of your body. You shouldn't stop eating or shouldn't stop drinking during the prescribed time period. No, it's not only that. Your fast has to have all the characteristics. What are those characteristics? We all know. We have to be pious. When we say pious, 5 times prayers. You see?
Yes.
When we say, I mean, what are other characteristics? We basically, fasting was basically meant to understand, to feel the pain of those who do not have enough to eat or drink.
And to
You see,
empathize with all the poor
basically,
people,
fasting
yes.
was made compulsory. What was the major idea behind? The major idea behind was they are unprivileged class in the world. There is privileged class in the world. They are hungry. They are, I mean,
Yes, I mean
belly
that is
full.
one of the dimension of that, but I think the primary purpose of the fasting is to become more pious, or the taqwa, right? Because it is clearly mentioned in the Quran that fasting was enjoined upon us so that we can become like the older days, so that we
Yeah.
can become more pious. And one of the aspect of piousness is obviously empathy, because obviously that's also a very divine sort of a quality. So
And
moving
also,
on to
Hajra, like
Yes.
you mentioned, like Hafsa, you were mentioning, the less you eat, I think the more you feed your soul, the more you feed your
Exactly.
spirit, the more you feed your ruh.
exactly.
Absolutely
Thank
correct. Basically, the principle of fasting is when I said that we have to be mindful of others.
Mindfulness.
Huzur
yes.
Akram sallallahu
Sallallahu
alaihi
alaihi
wasallam
wasallam.
would be fasting for 3 days,
Yes.
and when a beggar would come, beggar not in the sense of present days,
Yes.
beggar in the sense a hungry guy who really needed help. You see, on his call, he would, I mean, just give all what he had in front of him to be eaten by that poor guy. This is the basic principle, basic sense, basic idea behind fasting. Huzur Akram sallallahu alaihi wasallam, basically he exhibited the truth of fasting,
Yes.
the truth behind fasting.
Yes.
He basically exhibited that what is the main purpose of fasting. You see, what is happening? For example, in present day scenario, when we say tolerance, tolerance, I mean, for some time we set aside other prerequisites or characteristics. We focus on tolerance. Tolerance means when we have committed to God and we are fasting because God has ordered, then we have to submit ourselves. Whatever tribulations, troubles, problems we face during fasting, we have to think that that is order of the God, that is order of the Allah Almighty. So we have to bear all those tribulations, problems, difficulties with utmost patience. For example, practical examples. You're driving on the road, you see, and perhaps you left your office at say 5:30, for example. These days you have to start, breaking your fast at 6:24. So you think that I am running out of time. So I need to fly over all these cars which are in the queue on any major road, which is impossible. Keep 2 dates or a glass of water in your car. In worst case scenario, if you get stuck and you reach your home 10 minutes after, nothing will happen. You see, when you listen to, you are living in a Muslim country, everywhere adans you can be heard. You see,
Yes.
sirens can be heard.
Yes,
Just stop, just break your fast. That's all. But do not bicker, do not give your horn, do not disturb others. At the same time, give others rights. For example, you want to say something?
Obviously, we need to give space to others, and I think this conception of not honking should need to evolve even beyond the Ramadan and transcend to other 11 months too, because obviously we see that there is a lot of incivility on the roads. But let's call out the root causes of the intolerance or the impatience in the society. Fahim, I've always, I do have believe in the recent time that the social media is a very mediocre medium, because obviously the way people are interacting on it, Obviously because of the personalization of the algorithms based on our likes and preferences, it has created an echo chamber where we cannot interact beyond that echo chamber, and we like to connect with the like-minded people. So it is said in the English that birds of feather flock together.
Yes.
And that's very visible on the social networking sites. And I think that has also blinded them to the other point of view, and it has created a lot of intolerance on the society. And if you look through the Quranic injunction, you will find that Allah subhanahu wa ta'ala does not take a very high stock of the humans or the men or the Adam. And then if you remove this Quranic injunction and you observe the world history, you will find what happened with the Plato, you will find what happened with the Galileo, how they were executed at the hand of the state on the charges of heresy, right? These were all wise people, right? So in general, I think there is this propensity in the human beings that they do not like to go towards the wisdom or the wise. And I think social media has contributed towards this intolerance, impatience a lot, right? So what do you have
because
to say?
whenever there is
Yeah.
an opposing comment,
Yes.
opposing
Oh my
suggestion,
God.
you would
I would like
see
to. I would like to
Acrimony.
partly agree, and I would like to differ with your opinion about social media. You mean to say by basically, I mean, perhaps trends being perpetrated or directed through social media, they are creating intolerance. In my personal opinion, no, this is not the case. The case is people need to understand, people need to be retold the history of fasting. People need to be retold what is fasting basically. I mean, I have seen people calling names to others just before they have to break fast. I have seen people who show extreme limits of disrespect towards others just before fasting. You see, you are in a queue in front of a refreshment center where you are supposed to buy few things, for example, samosas, pakoras, whatever. So, you really want to grab those things in the first possible opportunity
Yes.
without
Yes.
least bothering for the queue.
Yes.
You see, basically what is that? That shows that we do not understand the basic principle of fasting. For example, when you are on road, the trend of that you should be the first in the long queue of the cars, what does that show? That you do not know the ABC of fasting. You know, fasting is perhaps that caliber when there was a battlefield and Sahaba Ikram,
Yes.
many, they had
Badr, Battle of Badr,
they
yes.
they were about to die and somebody brought water. When you are on the verge of death, I mean, you do not think about any other thing or any other person, but whoever, I mean, wherever that water was taken, each Sahabi, he said, no, please take this to the other Sahabi. He needs more. These days, we must tell ourselves, no, others need our respect. Others need our help. Others need to be treated better than we are. Basically, what is happening? We have become self-centered. We think that we are the only person in the world. Others do not exist. This character, which continues 11 months, that becomes aggravated because the fact is, when you are hungry, when you are thirsty, you need to have the chemistry of controlling yourself. You need to know the techniques. You need to reawaken the faith in Allah Ta'ala. You should know that even if I die, I will straight away go to heaven because I am fasting as ordered by God. In case I die, it's very easy ticket to heaven.
Yes.
If we start believing in that, believe me, all bickerings, all quarrels, all fights would end, and people would say, I would wait on this bakery or on this shop until everybody has purchased.
Yes.
Actually, yeah.
Yes, and thank you so much for beautifully putting it out. And I think we need to revive that spirit of Ummah, which you mentioned about how the Sahabas they preferred the other Sahaba when they were dying in the battlefield. And obviously that is lost somewhere in the, I think, 21st century.
Yes,
Thank you
and,
so much, sir, for coming
it's-
here.
Exactly.
pleasure.
I also must thank you because
I'm
it's
so-
exactly the fact that we have to look at it with a specific lens,
Yes.
with a lens of faith, with a lens of Allah subhanahu wa ta'ala
I think-
and His orders.
Yeah. Thanks for that. I would really like to reiterate one thing. Each one of us has a duty to tell others about fasting. People have really forgotten. They think
That's true.
stop eating and drinking is fasting,
Okay.
nothing else.
Exactly. And I think we have time and again said that it's not like that. It has a lot of spiritual dimension, it has a lot of a physical dimension and a lot of other metaphysical dimension too. So with that, we will say Allah Hafiz to you, and until next time, it's a goodbye and good morning.
And have a lovely weekend.